Welcome to Coffee with Coker, a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape. My name is Mark Reibold, and I'm the host of Coffee with Coker. And on today's episode, we're joined by Randy Gott, who's a senior vice president. Randy works in our physician compensation department, as well as works on community needs assessments for hospitals. And we're talking about a topic today. The title of the discussion is How to Determine Physician Needs and Maintain Compliance in Recruitment. And this discussion was actually based on a presentation that Randy had given to the Texas ASPR. And they were talking about physician recruitment for hospitals and specifically talking about maintaining compliance. And a common document and analysis process that Randy provides for hospitals is called a community needs assessment. And this is something, if you work in a health system environment or have in the past, you'll be very familiar with. It's a compliance document. And as far as is sort of a baseline understanding, it's something hospitals and health systems need every couple of years. However, what Randy has really done in this space is expand the application of this whole process. So it's not just a document that you get and you sit on a shelf or put it in a file for compliance purposes, checking it off the list, but it truly is a process that helps inform decisions and drive strategy as well as action stemming from that strategy for hospitals and their physician relations, their physician recruitment, and ultimately managing their physician network. So it's a really good discussion. It's something that Coker has done for many years with our hospital clients, and it's something that we've continued to build on as far as the depth and of the process and the value that the clients get from it. So we thought it'd be something that was worthwhile talking through. It was a quick discussion, but I think very informative. And Randy's going to have some additional information, white paper and articles and presentations on this topic to go into a little bit more detail because we cover it at very high level. And there are a number of things here that will require a lot of follow-up and more in-depth discussion, which Randy will have here in the future. And as far as that goes, I think this is a good way to provide a general overview and then stay tuned for follow-on content. As always, we thank you for listening. We encourage you to follow us. You can find this episode and all of our episodes on our website. That's coffeewithcoker.com, as well as the main Coker website at cokergroup.com. And you can follow us on social media and subscribe to us on all the podcast platforms that are out there. Again, thank you for listening. We hope you enjoyed this episode. All right, welcome back for another episode. And today we're talking about something new or something we have not talked about on the podcast before. And I'm really happy to welcome Randy Gott. Welcome to the podcast.
Thanks, Mark.
And today we're talking about, as I mentioned in the intro, the title is How to Determine Physician Needs and Maintain Compliance in Recruitment. This is definitely, it's a broad topic, I guess, that covers a lot of things. But what we are talking about medical staff planning and community needs assessments, but really how it ties to a lot of different things. And that's one of the main things, overarching points we want to get across today. So let's just dive into the discussion. And Randy, I think probably the best way we can start off is, I think there's a lot of terms or terminology that we hear thrown around as it relates to what we're talking about today, whether it's medical staff planning or medical staff development plans or community needs assessments, whatever that may be. Maybe just talk us through a minute. What is a medical staff plan and community physician needs assessment? What does that mean to you and what does that mean for Coker?
So people call me all the time and ask me, I would like for you to help me with a medical staff plan or a physician needs assessment. And a lot of times they're referring to the same thing. So I'd begin by saying there's a lot of terms that are used in this space. Physician manpower plan, provider networking plan, all of those things refer to the same type of an exercise. And so when we talk about this today, that's kind of what we're talking about. But basically, the needs assessment is a project where you're evaluating the makeup of a medical community and identifying the potential gaps or potential risks or lack of depth on a specialty specific basis. And that leads to what I would call a strategy or a plan to ensure that there's adequate provider coverage in a medical community on a specialty-specific basis. And people do these for a lot of reasons. The most historically, it's been a compliance thing where they document community need. But what it has kind of turned to now is a document or a process that helps them provide an underpinning to their overall physician strategy or their strategic plan.
So and we'll talk about the compliance piece here in a minute, but I think the interesting thing there is how it's turned or it's evolved from just being something to check off the compliance checklist, and it's a tool they can actually use in further planning and other activities.
Well, it's interesting that medical staffs are not replenishing themselves. So if you go back 20 years, a group of gastroenterologists, one person retired, they would just bring in another one.
Sure.
Oftentimes today, that's not the case. And there's a lot of reasons for that, which is a whole nother discussion.
Right.
But what this does is it helps the health system become much more deliberate in that process in helping those physicians and not being surprised by how they do it. And when you think about the cost of recruitment and so forth, it's important that you kind of have this as an underpinning for what you're doing.
Yeah, sure. Absolutely. So I guess how do they document? I mean, how does an organization document physician need?
So the process goes something like this. First of all, you have to understand what your market is, or what you would call a service area. And Stark regs have given us a definition that many people have used, which is the fewest number of contiguous zip codes from which you draw at least 75% of your inpatients. That's kind of a place to start. But the service area may actually go beyond that. But It's understanding, first of all, the demographics of your service area. And then secondly, what providers are there and what are they doing? So not just the ones on your medical staff or an organization's medical staff, but understanding what providers are out there that may or may not have anything to do with a specific organization. You have physicians who are part of another organization or have no privileges at all. Understanding who those people are, what they're doing. Are they part-time? Are they full-time? Do they have 2 offices or 4 offices? Do they just have 1 office? Are they semi-retired? All of those things to help you determine their specific FTE. And then going through what I call a quantitative analysis that basically says you have this many in your market and you actually need this many based upon the demographics of your service area. And then understanding things about age, how the physician age can have a bearing on potential need and recruitment and adding of different specialties. And then basically pulling all of that into what I call a recruitment plan or a strategic recruitment document that also takes into account potentially qualitative factors that you can gain that go beyond just counting FTEs.
There's so many different variables to understand this better. And I guess there's kind of the baseline compliance of maintaining community needs, kind of the primary service area statistic that you talked about. But I mean, using it as a tool and understanding, okay, what do we do with this information and make it actionable for us to not just go through a recruiting process, but to understand where we may have gaps in our current physician need.
Yeah, I mean, I kind of look at it like this. There's a statistical need that's based upon you have this many and you need this many, but there's also other things. For example, there's a qualitative need that may mean we've got enough doctors in this particular specialty, but for some reason we're losing patients. Patients in that specialty are being referred out to other areas, to other locations. Or age is another one that I think is a big part, especially when you see physicians who have no longer take calls. So you have 6 general surgeons and 3 of them are over 60, and those 3 don't take call anymore. All of a sudden, there's 3 that are sharing a pretty significant burden. Those are the kind of factors that go into this that make just you got this many and you need this many much more significant.
Yeah, and actionable. Talk about you actually talked through this a little bit already, but let's walk through just for people listening, kind of the methodology of going through this process.
So, as I said, basically the first thing is what's your service area? It can be counties, it can be zip codes, but basically how do you define it? It might be a primary, secondary, tertiary service area. It may just be one service area, but that's the first step in understanding what that is. Second thing, and very significantly, is understanding the makeup of the providers in your network. And as I said earlier, by specialty, by name, by practice location, by FTE, and then understand things about them, such as how old they are and what their plans are in terms of continuing to work. Once you have that information, you can do a lot of things with it. One of those things is basically project need based on the population. So if you have this many and you need this many, then there's obviously a deficit. But we believe that a more comprehensive needs assessment would include qualitative factors. And that's qualitative factors that would be gained based upon input from the physicians, largely, as well as administration. So we do that through a survey process. We do it through interview process. And basically what you're trying to do is get input from them on their perceptions about strength, weakness, outmigration, referral patterns, their perceptions of need, access concerns, and the doctors have a sense of what the recruitment needs of a market are. Once you have all of that information, you basically build a document that connects the dots that says, okay, in gastroenterology, we have this many, we need this many. The ages of our doctors are this. We've surveyed the physicians and we've learned this. We interviewed doctors and we found this. You're connecting the dots and building a recruitment plan and a rationale for your recruitment plan that takes into a wide range of information, including the strategic initiatives of an organization.
Yeah. Maybe talk through for a minute, if you will. So I'm sure you've worked with a lot of hospitals, health systems, where you've worked with them for many years or for extended periods of times where your relationship grows. When you're working, it may be initiated by, hey, we need to update our analysis or update our plan. But does it stop there? Or maybe just talk through, okay, what do you do after the plan's done?
So, as I said, we end ours with what I call a recruitment plan that includes specialty specific ranking that says these are where you need to be focusing your attention right now. And we rank all the specialties. So then the question goes beyond that to not just what, but now the question is how. And the question is, what's our willingness to act on some of these initiatives on a specialty specific basis? So, for example, when I say the organization's willingness to act, what I reference there is, we see situations where there's a particular need in a given specialty, and the physicians in that specialty in the medical community are all independent. And the organization says, we need more general surgeons. And these general surgeons that are there are unwilling to recruit. What's the organization's willingness to act on those things? So when you've got when you've got your information from your needs assessment, you need to understand, okay, we know what we need, but okay, what are our options now? What do we find other organizations doing in this particular specialty, in this particular situation? Are there regulations that impact what we do? And then what's happening in the recruitment industry that we need to be aware of? Those are the things that go into what in our ongoing relationships with clients. So most of our clients, we don't just do a needs assessment and go away. We'd like to work with them on an ongoing basis if possible. So, for example, we do a lot of compensation and fair market value work. That's where this comes in. So, for example, we can know that they have a particular dramatic need in a given specialty where they've struggled to recruit for many years, and that'll impact, what they may offer in terms of recruiting incentives and things like that.
Yeah, I think that's interesting because, it's probably easy to look at it purely from almost a disconnected perspective, but it really does tie to the compensation discussion as well, which ties into, the comp model that hospital system has and the plans that they're currently offered, and then maybe potential for growth in the future.
Well, also, even more importantly, the recruiting incentives.
Yeah, sure.
So, for example, today, it's not just if you're recruiting somebody coming out of training, it's not uncommon for there to be a lot more than just here's your salary,
sure,
and here's your relocation expenses. There are signing bonuses. There are pre-employment stipends. There are educational loans that are being repaid. There's a variety of things that can go into that particular offer. And the needs assessment can be part of the documentation that would be a part of justifying those incentives that are offered.
Yeah, absolutely. Let's circle back real quick to the compliance discussion a little bit. Help us maybe walk through that a little bit, because compliance is a big part of what COCR does. So where does this fit in the whole compliance discussion?
So how do we respond in terms of the overall needs of our medical community? Because this is not necessarily what the hospital needs or what the health system needs. This is what the community needs. This is not just what our organization needs. And so that's the first thing I would say. The second thing I would say is, in terms of compensation and recruitment offers and things like that, we believe that an organization needs what I call a recruitment policy that says, here's what we will do and here's what we will not do. So it's kind of like, the way I like to talk about it is, these are the boundaries within which we're going to play, and these are the plays we have in our playbook. Now, we've got plays in there that we may never use, but we have the ability to use those things. So basically, your policy says, here's what we do. Do we pay off school loans? Yes. What's our upper limit on that? Do we do signing bonuses? Yes. What's the upper limit on that? And then that gets everybody in the organization on the same page in terms of what we're going to do and how we're going to do it. And then in terms of assessing fair market value, when you're doing a recruitment package, how do we structure our recruitment incentives in such a way that they are consistent with fair market value and are commercially reasonable in terms of what other people are doing out there in the market? So those are two really big parts of the compliance process.
Well, that's extremely helpful, and I know there's a lot more to it. You're going to have a white paper coming out on this topic, and I know you've presented on it as well, and will be in the future. So we'll make sure that everyone has the appropriate links and access to finding more information through those documents, or perhaps attending some of these discussions. But this has been extremely helpful. I know we'll be talking about this more in the future, so there'll be a good amount of content related to this coming out in the future, but really appreciate it and look forward to talking more soon.
Thanks, Mark.
We hope you enjoyed that episode of Coffee with COCR, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. You can also find that through the main COCR website at cokergroup.com. You can also find us on social media, Twitter at COCR Group, and then on LinkedIn, you can search for COCR Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback, and we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.